My name is Brooke Duyon, and in this video I will be doing donning sterile gloves and a dressing change from wet to damp. So I will begin with the donning sterile gloves. So first you perform hand hygiene and obtain the correct size and check for any breaks in the package that can cause contamination to your sterile gloves. So you find the location for opening the wrapper, and you always want to open it away from your body to keep the sterile field. And then you will maintain a mini sterile field, and then you will open the wrapper and set it out. And the outer 1 inch is considered contaminated, so that's where you touch. So the first step is you pick up with your non-dominant hand and you insert your dominant hand and you keep it only on the outside flap. So once you have it on your dominant hand, you're going to take it and place it in the cuff. Make sure you keep in your thumb away. And then once you are able to do that, you interlace your fingers and make sure that it's a snug fit. Okay, so that is how you do a sterile glove donning. Okay, so with a dressing change, you assess the patient and you inspect to see how they are doing and determine if they need pain meds before you clean the wound. And if they do, you administer that 30 minutes before you come do the dressing change. So after you administer the meds and it's time to come and do the dressing change, you obtain your supplies and then you introduce yourself and explain that you'll be doing a dressing change and make sure that they are okay with it. And then you set up your sterile field and you pour the sterile liquid the correct way without contamination. The way you do that is you lip the bottle. It's called lipping. You pour a little bit of the contents to get any dust or microorganisms off of the lip of the bottle of sterile liquid, and then you pour just enough in the sterile bowl as you need without splashing, because if you splash, that'll contaminate the sterile field. So with your gloves already on, you remove the existing dressing and then you assess the wound for color, odor, presence of any sinus tracts, and you look for the presence of any granulation tissue, and then you measure the length, the width, and the depth by sticking the little Q-tip into it, and then you measure the Q-tip with the amount that it is. So after that, you remove your gloves, and then you apply sterile gloves like we did in the beginning, and then you clean the wound as ordered. Usually you go from the inside to the outside because you want to go from the dirtiest to the cleanest. Well, cleanest to dirtiest, I'm sorry. So then, after that, you remove the contaminated gloves, and then you apply more sterile gloves, and the way you do that, and then you dress the wound. So the way you do this is you take the 4x4s and you fluff one out and you stick it in the to cover the surface area of the inside of the wound. And then after that, you take unfluffed damp 4x4s to cover the fluffed one. And then finally you take a abdominal pad and cover the rest of it. And then after that, you secure it with tape. You usually put one across the top, one across the bottom, and 1 to 2 in the middle. And you want to make sure it's long enough to where it sticks to the body part that the wound's on or around, to make sure that the dressing stays secure. And then after you are done putting that abdominal pad, you write the date, time, and your initials on the dressing to show that it was done, because if it wasn't documented, it wasn't done. So finally, after that, you clean up your mess, ensure that the patient is comfortable, cover them back up, put the call light in reach, tidy around them, and then you take off your gloves and perform hand hygiene. And then after you're done, you document the date, time, and any findings with the wounds, such as appearance, size, drainage, any abnormal findings, or if it's doing really well and improving.